Good evening, and welcome to this comprehensive public health report. Tonight, we analyze the global surveillance operations and international agency statements responding to a rare viral cluster detected across multiple continents. This network of infectious disease monitoring was triggered by a severe respiratory outbreak aboard the luxury cruise liner, MV Hondius, which was traveling from South America. Official statements from the World Health Organization released in May 2026, confirmed that the complex multi-country containment effort began after a cluster of severe pulmonary illnesses was reported. The vessel carried 147 passengers and crew members of various nationalities, representing a complex epidemiological challenge as individuals disembarked at remote islands or flew through global transit hubs. Medical tracking operations span from the South Atlantic islands of St. Helena and Ascension to European cities like Zurich and Amsterdam, centering heavily on advanced laboratories and intensive care units in Johannesburg, South Africa. This developing situation has drawn intense focus from international public health authorities because genomic sequencing confirmed the presence of the Andes strain of hantavirus. This particular pathogen causes hantavirus pulmonary syndrome, a severe respiratory disease that can rapidly progress to acute respiratory distress syndrome, shock, and respiratory failure. While there are 38 distinct viruses in the hantavirus family, the Andes strain carries unique public health significance. It is the only known hantavirus variant documented to undergo limited human-to-human transmission, rather than spreading exclusively from animal reservoirs to humans. Epidemiologists emphasize that hantavirus infections are typically zoonotic diseases, meaning they are maintained in nature within specific rodent hosts. In standard environmental scenarios, human infection occurs when individuals inhale airborne particles or aerosols of dried rodent urine, droppings, or saliva, often during the clearance of confined, infested spaces. However, because the Andes strain can spread through close, prolonged personal contact, the discovery of cases moving through international maritime and aviation routes has prompted rigorous, proactive trace and isolate procedures to map all potentially exposed individuals and prevent secondary chains of transmission. The operational core of this response highlights the capabilities of advanced laboratory networks and specialized clinics. South Africa's National Institute for Communicable Diseases, or NICD, alongside the Gauteng Health Department, mobilized rapidly to identify the pathogen. Professor Lucille Blumberg of the NICD received an urgent notification from a United Kingdom infectious disease specialist concerning a critical patient who had been medically evacuated by helicopter to Johannesburg on April 27th. Within 24 hours of receiving the clinical details, South African scientists successfully confirmed hantavirus infection in the patient, a British national who remains in intensive care at a private hospital in Sandton. By May 6, the laboratory performed polymerase chain reaction testing and genomic sequencing to definitively identify the Andes virus. The surveillance data reveals a tragic timeline of progression. A 70-year-old Dutch national became the first fatality associated with the ship's cluster. His widow, an adult female who traveled as a close contact, went ashore at St. Helena on April 24th exhibiting gastrointestinal symptoms. Her condition deteriorated severely during a flight to Johannesburg on April 25, and she passed away upon arrival at a Kempton Park Emergency Department on April 26. Subsequent PCR testing on May 4 confirmed she was also infected with the Andes strain, prompting immediate contact tracing for all passengers on that commercial flight. Additionally, a German national died aboard the ship on May 10 after exhibiting fever and pneumonia. Beyond South Africa, international clinical portals are monitoring related cases. The World Health Organization reported that by mid-May, 4 patients total were hospitalized globally, including the British national in Sandton, 2 individuals in the Netherlands, and a patient in Zurich, Switzerland. The Swiss case involves an adult male who disembarked at St. Helena on April 22 and flew to Zurich via South Africa and Qatar, showing symptoms on May 1. Renowned bioinformatician Professor Tulio de Oliveira noted that South Africa's highly sophisticated respiratory surveillance systems, refined during previous global health emergencies, allowed the country to detect and isolate these imported cases immediately. Officials from the South African Department of Health confirmed to parliamentary committees that preliminary testing shows zero evidence that local rodent populations carry this South American strain, establishing that the threat remains an imported contained event rather than a localized outbreak. Public health guidance and official risk assessments remain focused on calm, systematic prevention and structured surveillance. The World Health Organization and the South African National Institute for Communicable Diseases emphasize that the overall public health risk to the general population is low. While the Andes strain can spread between humans, historical epidemiological data indicates that such transmission requires close, prolonged interpersonal proximity, such as that between spouses or direct caregivers, and is easily controlled through early isolation. Secondary infections among healthcare workers are documented in medical literature, but remain exceedingly rare, primarily occurring during the earliest symptomatic phases of the illness, when viral shedding is present. For general hantavirus prevention, public health agencies recommend avoiding direct contact with wild rodents and their nesting areas, sealing structural entries in homes, and using disinfectants rather than dry sweeping when cleaning areas where rodents may have been present, to avoid generating infectious aerosols. In the context of this maritime cluster, international tracking protocols are bound by specific limits of scientific knowledge, particularly regarding the exact timeline of exposure aboard the vessel. Because hantavirus possesses a long incubation period that can last up to 6 weeks, health authorities have initiated comprehensive monitoring programs for identified close contacts. In South Africa, officials note that while dozens of exposed individuals have been successfully traced, ongoing logistics involve monitoring these travelers until the full 42-day incubation window has concluded without the onset of febrile or respiratory symptoms. This rigorous observation strategy allows clinical teams to intervene immediately if secondary symptoms appear, ensuring patient safety and strict containment. Doctors on cruise liners generally maintain rapid diagnostic tests for influenza and coronavirus, but specialized pathogens like hantavirus require reference laboratory PCR facilities, emphasizing the ongoing necessity of international laboratory cooperation. Thank you for tuning in to this factual broadcast report. For more verified updates on global public health developments, please consider subscribing to our channel. The operational core of this international public health response highlights the critical mobilization of advanced laboratory networks, specialized clinics, and multi-agency surveillance frameworks across multiple continents. South Africa's National Institute for Communicable Diseases, or NICD, alongside the provincial Gauteng Health Department, assumed a central diagnostic role in identifying the imported pathogen. The operational timeline began when Professor Lucille Blumberg of the NICD received an urgent clinical notification from an infectious disease specialist in the United Kingdom regarding a critical patient who required medical evacuation. This patient, a British national, was airlifted by helicopter from an island location to Johannesburg on April 27, presenting with acute respiratory symptoms. Within 24 hours of receiving the clinical dossier, South African laboratory scientists successfully confirmed hantavirus infection. By May 6, the NICD reference laboratories had conducted advanced polymerase chain reaction testing and genomic sequencing, definitively identifying the pathogen as the South American Andes virus strain. Surveillance data meticulously compiled by the World Health Organization and regional ministries reveals a tragic timeline of progression within this specific travel cohort. A 70-year-old Dutch national became the first fatality associated with the cruise liner's cluster, passing away while the vessel was in transit. His widow, an adult female who traveled alongside him as a close contact, went ashore at the remote island of St. Helena on April 24th, initially exhibiting nonspecific gastrointestinal symptoms. Her clinical condition deteriorated severely during a subsequent medical transit flight to Johannesburg on April 25, and she passed away shortly after arrival at a Kempton Park Emergency Department on April 26. Subsequent PCR testing completed by the NICD on May 4 confirmed she was infected with the Andes strain, which prompted immediate contact tracing for all passengers and aircrew aboard that specific commercial flight. Furthermore, a German national died aboard the MV Hondius on May 2nd after exhibiting a rapid progression of high fever and pneumonia. Beyond South Africa, international clinical portals are actively tracking related cases to prevent further localized transmission. The World Health Organization reported that by mid-May, a total of 4 surviving patients were hospitalized in specialized isolation units globally. This includes the British national in Sandton, South Africa, 2 individuals currently undergoing treatment in the Netherlands, and a patient in Zurich, Switzerland. The Swiss case involves an adult male who disembarked at St. Helena on April 22nd and flew to Zurich via commercial hubs in South Africa and Qatar, first displaying clinical symptoms on May 1. Renowned bioinformatician Professor Tulio de Oliveira noted that South Africa's highly sophisticated respiratory surveillance systems, which were significantly refined and expanded during previous global health emergencies, allowed the country to detect, isolate, and sequence these imported cases with extreme speed. Officials from the South African Department of Health confirmed to parliamentary oversight committees that preliminary environmental testing shows 0 evidence that local African rodent populations carry this South American strain. This technical finding establishes that the current public health threat remains an imported, strictly contained epidemiological event, rather than a localized outbreak within the regional ecosystem. Medical authorities continue to review laboratory data from all affected transit points, contrasting verified genomic results against initial clinical misdiagnoses to map the precise progression of the cluster. Public health guidance, official risk assessments, and containment protocols remain strictly focused on systematic prevention, environmental control, and structured surveillance. The World Health Organization, alongside the South African National Institute for Communicable Diseases, emphasizes that the overall public health risk to the general global population remains low. While the Andes strain is scientifically unique for its capacity to spread between humans, historical epidemiological data indicates that such transmission requires close, prolonged interpersonal proximity, such as that between spouses, household members, or direct caregivers in unventilated settings. Secondary infections among healthcare workers are documented in medical literature but remain exceedingly rare, primarily occurring during the earliest symptomatic phases of the illness when viral shedding is present, and standard droplet precautions may not have been fully implemented. For general hantavirus prevention, public health agencies recommend practical, evidence-based takeaways that center on rodent exclusion and safe sanitation. Individuals are advised to avoid direct contact with wild rodents and their nesting areas, seal structural entries in homes to prevent infestation, and utilize disinfectants, such as a 10% bleach solution, rather than dry sweeping or vacuuming when cleaning areas where rodents may have been present, to avoid generating infectious aerosols. In the context of this specific maritime cluster, international tracking protocols are bound by distinct limits of scientific knowledge, particularly regarding the exact timeline of exposure aboard the vessel and the environmental conditions that facilitated the initial transmission. Because hantavirus possesses a variable incubation period that can last anywhere from a few days up to 6 weeks, health authorities have initiated comprehensive monitoring programs for all identified close contacts. In South Africa and across European transit hubs, officials note that while dozens of exposed individuals have been successfully traced, ongoing logistics involve daily symptom monitoring for these travelers until the full 42-day incubation window has concluded without the onset of febrile or respiratory symptoms. This rigorous observation strategy allows clinical teams to intervene immediately if secondary symptoms appear, ensuring patient safety and strict containment. Doctors on cruise liners generally maintain rapid diagnostic tests for common respiratory pathogens like influenza and coronavirus, but specialized pathogens like hantavirus require reference laboratory polymerase chain reaction facilities, emphasizing the ongoing necessity of international laboratory cooperation and rapid data sharing networks. From an ethical standpoint, global health agencies emphasize the responsibility of transparent reporting, and the avoidance of stigmatization regarding affected travelers, nationalities, or maritime routes. Ensuring that public health information remains grounded in verified laboratory data rather than speculative fear is critical to maintaining public trust and compliance with quarantine or monitoring requests. This case underscores the interconnected nature of global travel and the vital role played by robust, well-funded national surveillance systems in stopping localized health events from becoming international crises. Thank you for tuning in to this factual broadcast report. For more verified updates on global public health developments, please consider subscribing to our channel.